Welcome, everyone, to Vetfolio Voice. Today's episode, sponsored by Hills, features Dr. Yuki Okada here to discuss the importance of maintaining a healthy body weight for our pets. Of course, we know the importance of keeping our pets at a healthy weight, but sometimes it can be hard to keep up the motivation to have that conversation for the umpteenth time that day. We'll stay strong, my friends, and keep making those recommendations. I'll try not to give too much away, but a recent study examining the connection between a healthy body weight and longevity is incredibly eye-opening and really emphasizes the importance of keeping our pets at that healthy body weight. And Dr. Okada does a great job of addressing some of the challenges that come up when counseling owners about diet and body condition score. Dr. Yuki Okada was born in Japan and raised in San Francisco. Dr. Okada completed her BA at UC Berkeley and her DBM at Michigan State University. After practicing both Eastern and Western medicine for a decade, she became interested in nutrition and research and returned to her home country to obtain her PhD in veterinary biochemistry from Nippon Veterinary and Life Science University in Tokyo, while holding a faculty position as an assistant professor. When she's not seeing patients, she's completing a nutrition residency at Veterinary Nutrition Specialty Service, which is one of the 7 ACVIM nutrition approved residency programs in North America. She's published in peer-reviewed scientific journals and textbooks, including the latest co-authorship of a textbook chapter, Nutrition for the Hospitalized Patient and the Importance of Nutritional Assessment in Critical Care, in Advances in Small Animal Care. Dr. Okada also lectures for veterinarians in the US and Japan and loves to travel. She has one rescue senior cat who actually made an appearance on camera during our talk and I can confirm is in perfect body condition, and one rescue senior dog. If you enjoy this episode, you can find more CE from Dr. Okada and others on the Hills website, hillsnorthamerica.com. Let's go ahead and get into our episode. All right, well, for this episode, I'm joined by Dr. Yuki Okada, and we're going to talk about overweight cats. And I love doing these nutritional talks. I feel like I take so much away from these episodes. So, Dr. Okada, thank you so much for joining me.
Thank you so much, Dr. Cassie. I am very happy to be here. This is the topic that I'm most passionate about. I'm very passionate about keeping my patients and everybody, all the pets in the world, lean and healthy. So I'm very, very excited to be here.
Wonderful. Yes, and congratulations on being in your 4th year, finishing up your residency. That's really exciting.
I'm excited. Yes.
I can imagine. Well, let's go ahead and get into our talk here. What are some of the health risks associated with obesity? You know, we know that obesity is a problem in our pets, but what are some of the specific risks that we should make sure we're aware of?
So, everybody knows about risks of obesity causing diabetes in cats. And, that's pretty well known. There are also, diseases that can be caused by having that excess weight, or, the symptoms that could be worsened by having that excess weight. So the main thing, most important thing is osteoarthritis. So you have those dogs or cats that are already in pain, and adding that extra weight to those joints, of course, is not a good idea. There's also dermatological diseases that can be caused by skin folds, so extra tissue that can be, trapping the bacteria or infection and causing inflammation there. There's also respiratory disease and heart disease. So those patients that are having hard time breathing, you add that extra tissue and weight on top of the underlying diseases, then you're seeing, the symptoms worsen by being overweight. And there's also, a lot of people don't know about this, but, we know that there is decreased lifespan. That's been proven, especially in dogs. There's a great study done by Keeley that showed that there were 24 pairs of littermates that are matched for sex and weight. And the group that were fed 25% less than the control group and maintained that lean or ideal body condition lived actually 1.8 years longer. So that is substantial, in dogs that can only live for 14, 16 years. That's almost 20% of the lifespan that we can prolong.
Wow, that really paints a picture. 1.8 years. I mean, who wouldn't want their pet for an extra 1.8 years, an extra 2 years, 20% of their life? I mean, that's huge.
Yeah, that's really, that's a convincing sort of statement for a lot of owners that can be skeptical about, you trying to push weight management in those cats and dogs. And if you say that magic word, yeah, we can, prolong the lifespan. And, a lot of my clients are like, we're convinced I want my pets to live as long as possible.
Absolutely. And I noticed when we were talking about some of these health risks, you mentioned a lot of itises, a lot of inflammatory processes, arthritis, dermatitis. We know that diabetes is very inflammatory. Can you talk about the relationship between obesity and inflammation?
Until recently, fat cells were considered, or fat tissues were considered to be just the storage organs, storing the fuels and energy when needed. But now we know more about fat cells and fat tissues that, we consider them as more endocrine organ that can affect the functions of other organs through secretion of pro-inflammatory cytokines or other cytokines called adipokines. So, cytokines secreted by adipose cells. We know that enlarged, engorged cells, fatty cells, can secrete pro-inflammatory cytokines and harmful cytokines that can affect the brain and the liver, and also by doing so increase the appetite, cause insulin resistance, sort of affect the energy metabolism in liver, causing hyperlipidemia and hyperglycemia.
That's a little bit scary to think about. Like you said, fat as kind of this pro-inflammatory endocrine organ. And if I'm understanding you
Mhm.
correctly, it kind of brings into perspective. I feel like I've had like a big focus on healthy eating for myself recently. And honestly, it has drastically affected the way that I feel. And I can only imagine that's got to be related to inflammation.
Yeah, it's scary to think that, you have extra adipose tissues and those engorged adipose cells, and you're actually causing chronic low-grade inflammation by having those excess fat cells.
And I can't fight it off anymore like I could when I was 20.
Exactly.
So we touched on arthritis earlier. And of course, we think about obesity and orthopedic disease, the extra weight on the joints. I also know more recently we've looked at changing our spay neuter recommendations due to orthopedic disease. In our initial conversation, kind of before we turned on the microphones, you mentioned all of this might be interrelated with our spay neuter recommendations and obesity and orthopedic disease. Can you elaborate on that a little bit?
Yeah, so a lot of these, every time these new recommendations come out, I try to go to the paper, scientific journals, to kind of look at the validity of the study or the message that's delivered by these studies. And there are some good ones, but a lot of those papers don't talk about the body condition score of the patients between the control versus the test group. So that's something that would be interesting to see. I just hope all these future papers will have compared the comparison of body condition scores. But because we know for sure the extra weight on those developing joints, especially during the puppyhood or kittenhood, those are affect and cause developmental orthopedic disease. So I would love to see more studies that are comparing the body condition scores between these groups.
So, am I understanding you that we're looking at the impact on orthopedic disease with spay neuter from more of a hormonal standpoint? But
Right.
because we know that in spayed and neutered pets, they do hold on to adipose more and it is a little bit harder to control their weight, that maybe there's an element there with spaying and neutering and orthopedic disease in addition to the hormonal influence.
I do think so. We know for sure there are good studies out there indicating that there's decreased metabolic rate in spayed or sterilized patients. That's sort of, we know about that. And also aging can cause a decreased metabolic rate. And also there's a study looking at cats being spayed. And so within few days of being sterilized, these cats have increased food intake for sure. So there's that combination of, yeah, you need to rest these patients well after the surgery for the healing, and then there's increased intake of the food. So, those patients are at risk of gaining more weight.
Sure. It's one of those things where, I mean, to gain weight more easily and then have an increased appetite. Those poor, poor
Yeah.
critters. I feel bad for them, but having
Yeah.
treated my fair share of pyometras, I would all for the spay and neuter.
Right. So, I do practice as a GP, general practitioner as well, full time. And, my clients always ask what's the right thing to do, and I would say whatever you choose, the right thing to do is for you to keep this patient at an ideal weight.
I love that. I love
Yeah.
that. How whenever you choose, because none of us I was really hoping that was going to be the key there, Dr. Okada. I thought you were going to say the right answer is you spay at this age, but it sounds like the jury's still out.
Right.
So, of course, we're here to talk about overweight cats. What are some of the general dietary recommendations that you discuss with cat owners?
So overweight cats, if we starve an overweight cat, we're going to have a weight loss. That's just simple, right? But having an effective weight loss and having the appropriate weight loss rate, and while making sure the client and the pet are happy, that can be very, very challenging.
Sure, because having an overweight cat, who I would assume is also sterilized, they're going to have this increased appetite, and starving them, in addition to just, kind of being mean, I don't don't want anybody
Mhm.
to severely restrict my calories, can create its own set of problems.
Right. So begging is the most sort of common challenge and the most difficult one to fight this overweightedness. It really decreases that compliance by clients because all of a sudden clients are being woken up, 3 in the morning, this cat's crying, yowling, biting to, in order to be fed. So this is the biggest challenge that we face.
Sure. What do you tell owners when they say, I've tried, I can't get my cat to lose weight because they're standing on my head at 3 o'clock in the morning every day. And if I lock them out of the bedroom, they just stand outside the door and scream all night. Do
Right.
you have any kind of good tips for them where you say, okay, that's reasonable to not be able to deal with that, but here's some
Right.
alternatives you can think
Yeah.
about?
So the strategies that I use, or a lot of nutritionists use, is to increase the fiber in the diet, moisture in the diet. So these are, something that can help to distend the stomach, so increase the satiety, right? Another thing is, feeding more frequently in small amounts, and especially at night, so that the cat's not waking up the client.
Sure. And of course it's much easier if they never get overweight in the first place and you don't have
Right.
to go down this weight loss road as so
Yeah.
many of us do with our pets, veterinarians
Hmm.
included. Well, I know we all deal with this. So, what do you talk to people about in kittens when they first bring you a brand new kitten and say, how do I keep them at a healthy weight?
Right. So I do at an initial exam, I pull out my body conditioner score sheet and teach my client how to assess his or her pet's body condition. It's because it is so much easier to prevent the overweightedness than treat it, like you're saying. So that's what I do initially. And I do teach all my technicians how to assess the body conditions. I'm seeing a trend of everybody underestimating the body condition score. So the perception of ideal weight has shifted tremendously, I feel like. So, I do have a lot of clients that come to me and say, my vet never told me my dog is overweight or my cat's overweight. And I felt like that when I first started my residency. I have 17 years of experience as a GP, and going into the residency, my mentor quickly corrected me on my assessment of body condition score.
I have to say that does make me feel a little bit better because I promise you I am guilty of underestimating body condition score, and
Mhm.
to be talking to somebody who's so passionate and know that you had to shift your viewpoint of what an ideal body condition score was too. That gives me hope that I can
Yeah.
I can get
Yeah.
my thinking in the right plane.
And then in doing so, in assessing body condition score, teaching my technicians how to do this, I find out that during like a common day, more than 50% of my patients are actually overweight.
Sure.
And that's just, it's more than what the other studies have shown. Usually it's like 20, 30, 40%. So 50%, more than 50% is a lot. And maybe it's because I'm in San Francisco, maybe those could be a regional thing, I'm not sure, but it
No,
is a,
I
it
don't
is a
think
true
so.
fact.
I would say I'm probably in the same boat.
Yeah.
So let's kind of transitioning back to cats here. Many of our feline patients, they kind of lay around. They're pretty lazy. Maybe they get up and run around at night, or they have small bursts of energy, but not a ton of activity throughout the day. Do you talk to owners about exercise or increasing activity at all?
Not really, because a lot of owners want to believe it's the lack of exercise that's causing their cats to be overweight. And it's really not, because cats and just animals in general are very, very good at conserving energy, because every time they hunt and they're spending so much energy that, whatever they're eating is not matching the energy requirement. That doesn't make sense, right? So it's really the exercise, not the main way that I try to do the weight management. There's a study done by Dr. Richard Hill. He's an expert in greyhound nutrition. And it really those studies have shown that those dogs don't really spend more energy than your normal house dogs that gets, twice a day walking and some dog park activity. So like you can see, that those dogs that are running so fast, they're not even spending a lot of energy. So for the normal clients, to make the cats or dogs to really run around to lose the weight, it's really going to be impossible to do that.
So tell me a little bit more about weight loss diets, especially talking about cats. They can be kind of finicky and it can be tough to find the right diet for them. What are we looking for in a diet to say, okay, this is appropriate for weight loss?
So I guess number one thing is that diets should be palatable, right? For finicky cats. A lot of times what happens is they're being finicky because they could be holding out for something better. So there's a lot of treats involved, high reward, some kind of food involved. So it's a good idea to do a good diet history, taking a good diet history from the owners, making sure these cats are not getting any what we call empty calories from treats. And other things, I look for in a weight management diet is how we talked about, it's higher in fiber to distend that stomach, to give that satiety. Moisture can be, canned food already has pretty high moisture content, about 78 to 80% would be from the moisture. So that would be good. I sometimes add extra water on top of that. And also for dry food, I try to add that water, but cats, unfortunately, they develop texture preference pretty quickly. So it really have to, depend on what the texture preference of the cat. Of course, you don't want to give dry food or wet food to somebody who only eats dry food or canned food and starve the cat and cause hepatic lipidosis there.
They would lose weight, but it would come at a
Right.
cost.
Yeah. So, and then the other thing is, I do look for, when I formulate homemade diets, I do try to make sure that there are extra nutrients, essential nutrients, because when you start restricting those calories, you are actually reducing the essential nutrient intake as well. So when I make homemade diets, I will make sure there's extra, like 200% of the requirement or whatever caloric restriction, what I'm doing based on that, I will adjust the essential nutrient concentration to make sure that there's no nutrition deficiencies. A lot of the weight management diets out there have extra nutrients to make sure that there's no nutrition deficiency by caloric reduction.
Okay, interesting. And then what if you get these clients who say, I hear all of your options here and I'm just not interested. I don't want to change the food. I'm happy with where I am. What can I do with the food my pet's currently on?
First of all, recommend stopping all the treats, because those are empty calories that can dilute the essential nutrients provided by the complete and balanced diet. So that's the first thing I do. And then I will ask the owner to reduce the feeding amount by 15 to 20% max. Just because if we did more than that, then like I said, there's not going to be enough essential nutrients to account for the caloric reduction. Most diets out there, even the maintenance diets, have about 120% extra of the requirement set by the AFCO or NRC. So I feel pretty safe recommending about 20% feeding reduction.
And is that specifically in cats or does that go for dogs too?
Dogs as well.
Okay. All right.
Yeah. In cats, though, with the 20% caloric restriction, the weight loss rate's going to be slower. So it's going to take more time to lose that weight, but that's okay. And I do want that weight loss rate to be as slow as possible. So about 0.5% of body weight per week of a weight loss, just to be on the safe side. If we are doing more aggressive weight loss using the weight management diets, the rate can be faster. So I aim for about 1 to 2% of the body weight loss per week.
1 to 2% per week on the weight loss
Mm.
diet because we know that those are more nutrient dense.
Right, right.
Okay. And I'm glad that you brought up how much weight to lose per week, because that was going to be my next question is how do we know if our recommendation is working? How do you monitor
Right.
these patients?
Yeah, so monitoring is the key. It is the most important thing that you do because it's hard to know how much caloric restriction is going to cause ideal weight loss rate because we just don't know. A lot of times we don't know the current caloric intake that's maintaining that heavy weight or over obese weight because the diet history is not complete, because there are multiple cats in the household that could be stealing and giving extra calories to this overweight cat, or there could be children dropping human food items on the floor and cats eating those, or that grandpa and grandma that want to sneak little treats here and there. So we just don't know a lot of times if we're getting that accurate diet history. So a lot of times it's the gold standard to base our ideal caloric intake for the weight loss on the current caloric intake, but it's not always easy to get that. There are also equations to help find out what would be the appropriate caloric intake for weight loss, but those equations are not for everybody. Some cats have higher metabolic rate, some have lower metabolic rate. It can be about 50%. So this is why you need to monitor every 1 to 2 weeks if possible, making sure that the weight loss is happening, first of all, and weight gain is not happening, and making sure that the weight loss rate is at an ideal rate and not too fast or not too slow.
I am glad that you said that we don't always have the complete diet history, because that is something that always stresses me out when I hear you get a diet history. I never feel like it's complete. I'm always like, there's something else there that I'm not aware of, that probably not because the owner's withholding information, but they might not be aware of either because they're doing it so automatically, it just doesn't even ping in their head. Or like you said, there's somebody else in the house who is also feeding this pet. It makes me think of a patient I had who was very overweight, and we put her on a weight loss diet and we did all the calculations and we were bringing her and reweighing, and the owner was like, this is all that she's eating, and she was gaining weight. And I remember I called the company and I said, help me out. What's going on? They said it is physically impossible for her to gain weight at this calorie level. And I think we did end up identifying somebody else in the house that was maybe sneaking some treats. So,
Yeah, that's very, very common. And also, we can't forget about, supplements, the calories brought in by supplements, dental chews, and also pilling treats. Those are really, easily forgotten.
oh gosh, yeah, I didn't even think about like pill pockets and pill wrap and those kind of things.
Mhm.
Interesting. Well, if we're bringing these guys back, we're monitoring them so that we can find whoever is sneaking treats, or whatever part of the diet history we missed, and we can make the appropriate adjustments so our patient can lose weight, get to this appropriate body condition, hopefully live 1.8 years longer. I mean, that's a big job, but it sounds like this can really be a team sport. So can you talk about how you get your team involved in monitoring these patients?
Yeah, I think it's a good idea to really utilize your receptionists and technicians, because once we teach your support staff, it doesn't need a lot of sort of high medical knowledge involved, right? Because it's all numbers. You look at the weight, you look at how much percent of the weight loss has been done, and then you just get that diet history every time the patient comes back to make sure that the total calories are not, going over what we recommended.
Perfect, perfect. I think probably the biggest thing there is teaching them how to use the body condition score, because as we've established here, I'm probably not great at using the body condition score chart, so we could all use a little refresher.
Yeah, there are a lot of sort of references online. There are different pictures. So that's something I do like everybody to, look at those body condition score charts again, because you may think you know it in your head, but when you look at it again and read all the descriptions, you may find out something that you didn't know.
Absolutely. Well, Dr. Okada, once again, a fantastic nutrition conversation. Like I said, I always feel like I take so much away from all the talks that we do on nutrition. So thank you so much for joining me. Are there any final thoughts you want to share with everyone?
No, I think this is really something that really will help all our pets, all our patients. Extending, there's nothing in veterinary medicine that can actually extend, prolong lifespan, right? We can extend life by treating a disease, but this is something that we can prevent the disease and also prolong healthy lifespan. So I really would encourage everybody to be on board.
Fantastic. Well, thank you again for joining me. This has been a great talk.
Thank you so much. It was great as well. Thank you.
Thank you so much, Dr. Okada, for coming on the podcast. I feel like you've given us some great information to consider when it comes to keeping our pets at a healthy body condition score. I also want to say a big thank you to Hills for making this podcast possible, and thanks to all of you for joining us. For more episodes like this, click on the Education tab on the Vetfolio website. As always, we'd love to hear your input on this talk, as well as ideas for topics you'd like to hear from us in the future. Feel free to reach out to me at dvm@vetfolio.com. You can also visit my Facebook page at Dr. Cassie DVM, and you can find me on LinkedIn. And remember, if one animal is better off because of you today, it's a great day.